name is Victoria Birch. My student ID number is 3153227. This is the 2017 fall semester. So the general cage of a rat should include fresh water, bedding, and then also rat pellets. And we also do feed him small amounts of vegetables and fruits since he is a pet rat. Ordinarily, a rat should eat about 5 grams of food per 100 grams of body weight. There are many types of identification that you can use for rats. There are permanent and temporary ones. You can identify them by a cage card or a colored marker that will eventually wash off. The permanent ways you can identify rats are going to be tattoo or ear punches. So when handling rats, it is important to wear latex gloves just because rats and mice are susceptible to all kinds of infectious diseases caused by viruses, bacteria, and parasites. The most common diseases we see in rats are going to be tumors. They can get endo and exo parasites, and also rats can get a number of upper respiratory infections that can be caused by any kind of bacterial infection, mycoplasma, streptococcus, or pasteurella. When rats and mice are under anesthesia, it's important to monitor their neuromuscular reactions. Example, like pinching their foot or whether or not their whiskers are twitching. They just help to evaluate the overall depth of anesthesia in the patient. For long surgical procedures in rats and mice, it's important to monitor the possibility of hypothermia by keeping the patient warm with warm water bottles or a heating blanket or even like a warm towel. The most common types of anesthesia or tranquilizing agents used in rats are either isoflurane, which is an inhalant. You can use ketamine, diazepam, or propofol, and those are all going to be injectable forms. When recovering these patients, it's very important that you are with them until a full recovery and they are sternal and upright and walking. Pocket pets have trouble regulating their temperatures when they're under anesthesia, so it's important that they stay warm while recovering. Can carry zoonotic diseases. There are 3 different ways that you can restrain rats for physical examination. The first way being, you can hold a rat by their tail, but you want to hold them at the base of their tail and not the tip of their tail. So you can pick them up like this. The second way that you can restrain them is just scruffing them like you would a cat. And then also holding them at the base of the tail like this, and this just immobilizes them. The third way that you can restrain a rat is by taking your pointer finger and your middle finger and placing it right behind his head. And then you're gonna take your thumb and your index finger underneath his arms like this, and then also hold him at the base of the tail. You can restrain them just like this. Determination of a rat's gender can be done at birth. Males have a larger genital papilla and a greater distance between the papilla and the anus. So this guy is most definitely a male. Females won't have this papilla right here. Also, female rats develop 5 pairs of nipples by the age of 9 days old, which this guy does not have. So the reason why rats can reproduce so quickly is because females are spontaneous ovulators and continuously polyestrous with a 4 to 5 day estrus period. So I'm gonna administer just some saline to this little guy. I'm gonna use a 25 gauge needle and give it subcutaneously. So I'm just gonna pinch his skin up in a tent and then insert my needle at a 90-degree angle. Go in and pull back and make sure I'm not in a vein and just administer the medication. Now I'm gonna demonstrate how to give an oral dose to a rat. So I am just gonna administer a little bit of saline, and I'm gonna pick him up by his scruff, just like this. I'm gonna place the syringe at the corner of his mouth and then administer the medication. Just like that. I'm gonna demonstrate how to draw blood on a rat. I am going to administer some isoflurane anesthesia just for the sake of getting him to stay still for the blood draw. I'm just gonna take a mask and place it right over top of him, and I'm gonna turn on the O2 and the isoflurane. Once he's asleep, I'm gonna just take a smaller mask and put him in dorsal recumbency and put his little head inside the mask. And I'm gonna put him on a low dose of isoflurane just for the purpose of his blood draw. So I'm gonna use a 1 ml syringe with a 25 gauge needle. I'm gonna start by occluding the base of the tail. I'm gonna apply a little bit of alcohol. With my bevel up, I'm just going to insert my needle into his tail. Then I'm gonna grab a cotton ball and just place it right at the end of the tail. And there's my sample. So this is the mouse's enclosure. He does have fresh water. He has mouse pellets, a little house he can sleep in, and also a running wheel. This is a pet mouse. So he does get the occasional fruits and vegetables added to his diet. Just like the rat, you can use permanent form or temporary forms of identification for mice, including cage cards. Or using the ear punch code, you can also identify them with a marker if they are white mice. When handling mice, just like rats, you want to handle them gently. You can pick them up by the base of their tail, but not the tip of their tail or anywhere in the middle. When you're handling mice, it's important to wear latex gloves because mice are also carriers of zoonotic diseases. The most common diseases we see in mice are going to be upper respiratory infections. Sneezing, ocular discharge, or nasal discharge can all be symptoms of mycoplasma, pasteurella, streptococcus, or any number of bacterial infections. These guys are also known for getting endo and exo parasites. Another thing that we commonly see in mice are tumors. The most common way of anesthetizing mice is going to be using isoflurane, which is an inhalant. Once they are recovering from anesthesia, you do want to stay with the patient until they are fully recovered and their temperature is back to normal. The most common way to restrain a mouse is scruffing them behind the neck just like you would a rat. I'm gonna poke him up by his scruff and then hold him by the base of the tail to immobilize him. So this mouse is a female because there's an absence of a scrotum. She also does have nipples, which are absent in male mice. Mice, just like rats, are spontaneous ovulators and are polyestrous. Now I'm gonna demonstrate how to give a intraperitoneal injection to a mouse. This usually can be done with one person. I'm just going to scruff the mouse just like before. I'm gonna get his tail and tuck it between my fingers just like this. I'm gonna take my syringe, which is just 0.1 mils of saline, and using a 25 gauge needle, I'm gonna put the needle into the left quadrant of the abdomen, pull back and make sure I'm in the right spot, and then just administer the medication. Just like that. Now I'm gonna demonstrate how to give a subcutaneous injection to a mouse. So I have him scruffed and his tail is tucked in between my fingers. I have a 1 mil syringe with a 25 gauge needle filled with saline. Give this injection subcutaneously by going in between the tent. I'm gonna pull back and make sure I'm in the right space, and then just give the injection to the mouse. I'm gonna administer an oral medication to this mouse just by scruffing him like before. I'm gonna place the syringe at his mouth and then just administer it just like that. When housing a rabbit, they should have a fairly large enclosure with bedding. Their cages need to be cleaned daily and fresh water needs to be provided daily as well. So this is this rabbit's temporary enclosure. He has shredded paper as his bedding, fresh water, Timothy hay, and also commercial pellets are available. So indoor housing should be maintained at a temperature between 62 and 70 degrees Fahrenheit. Commercial rabbit feed typically has about 15% protein and 10% fiber. A rabbit's main diet should consist of commercial pellets, but you can also feed them Timothy hay along with the occasional fruits and vegetables. When handling a rabbit, you want to make sure that their back legs are secure. If their back legs are not secure, then it can cause damage to their spinal cord. When transporting a rabbit, you can put their back feet on your forearm and then tuck their head into the crook of your elbow and then lightly scruff them behind the neck to transport them. You can also support their hind leg and secure them to your chest. For pet rabbits, it's extremely important that they have lots of different toys and chew blocks so their teeth don't overgrow. Rabbits are prone to a lot of gastrointestinal, dermatological, respiratory diseases. As with most small animals, maintaining a proper diet and housing play a significant role in keeping these pets healthy. Many different symptoms like sniffling, ocular discharge, a head tilt can be indicative of many different diseases like pasteurella. Rabbits are also prone to getting many different types of endo and exo parasites. Symptoms of your rabbit having exo parasites would be hair loss or itching, and endo parasites would be things like diarrhea, not wanting to eat, acting lethargic. When we anesthetize our rabbits for surgery, we use a mixture of diazepam and ketamine, and throughout the surgery we will use isoflurane. Just like when you are handling rabbits, when you restrain them, you also want to support their back feet. You can lay them in dorsal recumbency and hold them just like this for your doctor to examine. If the rabbit doesn't like being in dorsal recumbency, you can get a towel or a hand towel and just wrap him in it securely and place them on your examination table just like this. When determining gender on a rabbit, you just place 2 fingers on the genital opening. Females have a slit-like opening like so, and this one is a girl. tail. And males have a rounded opening. They also do have 2 testicles. However, males can suck their testicles up into their inguinal canal, making it hard to determine gender. But females will have a slit opening when males have a rounded opening. Also, when you apply pressure to the genital opening on a male, it will extrude the penis from the opening. Does do not have a typical estrus cycle. They are induced ovulators and show seasonal variation in receptivity. Now I'm going to demonstrate how to give a sub-Q injection to a rabbit. This is just a 1 ml syringe with a 25 gauge needle, and I'm just going to administer 0.2 of saline. I'm just going to pinch his skin up to make a tent. I'm going to go in, pull back, and then administer the injection, and that's it. Now I'm going to demonstrate how to draw blood on a rabbit. I'm going to collect his blood using a 1 ml syringe with a 25 gauge needle. So I have the rabbit laying in lateral recumbency. I'm going to get blood from his saphenous vein. I'm going to apply some alcohol to the vein, and he's going to occlude the vein for me. Get my needle with my bevel up. I'm going to apply pressure to the vein, and there is my sample. So when restraining any kind of bird, you never want to take them off of their owner's shoulder. You want to catch them either from their cage, their carrier, or on the floor. When trying to catch a bird, you might want to use a towel. That usually works best. I'm just going to take this hand towel and place it around his wings and hold him just like this. So when I'm holding him underneath the hand towel, I just have my index and thumb finger around his neck. Once I have his wings pinned with the towel, I can hold his legs just like this. So in case he does want to bite, all he's going to be able to bite is the towel. And this allows my doctor to examine the bird safely. Now I'm going to demonstrate how to trim his nails. This is a 2-person job. It's going to come and grab him and hold his wings. Okay, I'm just going to take his foot and trim just the tip off of all of his nails. And I'm just going to take the tip off each toe, not going too far to quick him. When examining a bird, the first thing you want to start with is getting a detailed history. Husbandry related problems are very common in birds. Many medical conditions can be related to poor diet and poor husbandry. The respiratory rate should be smooth and regular. There should be no increased effort when breathing. You also want to observe the bird's walking ability, their posture, and their feathers. You also want to examine the eyes, the ears, the beak, and the oral cavity of birds. You want to palpate the crop, the esophagus, the pelvic region, the tail, the feet, the back, and the wings of the bird to check for any abnormalities.